now it's time to apply our knowledge about pharmacodynamics, especially the receptor mechanisms. We already discussed how many types of receptors, second messengers. So here I am going to explain and how to analyze some cases with multiple choice questions. Here is the first case. We have 51-year-old woman presents to the clinic with severe dehydration. In response to her brain releases a peptide, the target cell in her kidneys, right? So you see the severe dehydration, so that means your body try to conserve the water, right? So dehydration, that is a diuresis, right? You're losing a lot of water, so that means you have some mechanisms in the body, that is the anti-diuretic hormone, anti, right? So it prevents the diuresis to conserve the water, ADH, right, from the posterior pituitary, and it acts on the kidneys. Hey, you lose a lot of water, man, so stop doing that. We need water for the body, right? So that's what anti-diuretic hormone comes into the picture. The peptide binding that gives rise to increased cyclic AMP to reduce the volume of urine produced, right? So that's the compensatory mechanism by anti-diuretic hormone. And also you get, this is the major clue here. The signaling mechanism is the increased cyclic AMP, and they are asking which of the following best explains the signaling by this peptide. Let's just think about, we talk about 4 different types of receptors and signaling mechanisms, right? So G protein coupled, ion channels, intracellular, right, and tyrosine kinase, right? And also some drugs, they directly target some of the enzymes or macromolecules. So here this guy is targeting increases cyclic AMP. I think you got the correct answer. So let's see what are the options. Always is better to get a correct answer before revealing the options. That's the best way, right? So number 1 activates opening of ion channels. Is that correct? No, because cyclic AMP, it is mainly G protein coupled, right? Either maybe G protein stimulatory or G protein inhibitory, right? So the second one, activation of protein kinase A, right? That's the correct answer, right? So protein kinase A, what happens? So ADH act on, also known as vasopressin, so V2 receptors, okay? So V2 belongs to GS. We know the GS drill is, right? So GS activation, activation of adenyl cyclase. Adenyl cyclase increases cyclic AMP, then that leads to increased protein kinase A, right? So then it inserts a lot of aquaporins in the nephrons to reabsorb water into the system, right? So that is antidiuretic hormone. And also there is a nice 6 minutes video how to remember all the signaling mechanisms. So please watch that video, then you never forget all these G protein coupled receptor. That is very important for your exam and also for understanding, okay? So diffuse through the plasma membrane and binds to nuclear receptors. These are mainly the steroid like glucocorticoids, prednisone, or thyroid, or vitamin A, vitamin D, right? So these are intracellular. And phosphorylation of receptor leads to activation of intracellular signaling molecules. So that is tyrosine kinase. So what is the tyrosine kinase receptor mediated? Example, insulin or growth factors. And receptor activation leads to activation and upregulation of protein kinase C. The protein kinase C mainly, which is G protein? That is a GQ, right? So GQ, lot of C's. The phospholipase C, IP3, DAG, calcium, protein kinase C, that is the GQ, right? So not GS. So the correct answer is activation of protein kinase A. All right. So it's here, this is a physiological concept. So whenever you have patient is a dehydration, there is a release of ADH in the kidneys collecting duct. ADH binds to vasopressin 2 types receptors, that is a GS mediated. So GS, we know that increase adenyl cyclase, increase cyclic AMP, protein kinase A, that inserts the aquaporin channels to reduce the urine volume. Next one, which of the following best describes how benzodiazepines act as an agonist at GABA receptors, and what is the signaling mechanism? So you guys got this one, right? So we know that GABA is the gamma aminobutyric acid inhibitory, so inhibitory neurotransmitter, the brain, right? So it has a various role in the body, like epilepsy or muscle relaxation, right? So what is signaling mechanism here? So the crosses the membrane, binds to cytoplasmic receptors. No, that is the steroid hormones. Activation of the receptor, opening ion channels. That makes a lot of sense, right? So GABA is the mainly ion channel, that is especially the chloride entry. That is the correct answer. All right. So activates adenyl cyclase. No, that is a G protein stimulator, right? So that is not a correct. This is not a correct, right? So this is the B is the correct answer. And option D, G protein IP3, this is the GQ. So that is not a correct answer. And option E, activation of tyrosine kinase, this is mainly by so insulin and growth factors, that is the tyrosine kinase. So that is not a correct answer. GABA is the chloride channels. So this is another mechanism we talk about receptor types, ion channels. The correct answer is B. Next one. A pharmacological evaluation of the cancer chemotherapeutic agent reveals that the cell surface receptor is the epidermal growth factor receptor family. Which of the following is the mechanism of signal transduction of this receptor? All right, so here is a growth factor, and also they mentioned that the receptor present in the membrane, right? So we talk about a lot of things about the membrane bound receptors. Is it a G protein? Yes, G protein is a membrane bound, but epidermal growth factor don't affect the G protein, right? GQ, no, tyrosine kinase, right? So this is the correct answer. Tyrosine kinase, epidermal growth factor present in the membrane, right? So binding of these growth factors, there is internal phosphorylation, then downstream effects. And ion channels, mainly the GABA and potassium, calcium channels, that's different. All right. The next one, the study evaluating target of certain hormones action. The hormone is an intracellular receptor. Okay. The normally resides within the cytoplasm. We already discussed that cytoplasmic receptors, right? The medication, they are just lipid soluble, crosses the membrane and binds to the cytosolic receptors like heat shock protein 90, right? So then it goes to nucleus, causes transcription. It takes slow onset of action, right? So you got that one. So identify the hormone epinephrine, no, right? So epinephrine, alpha adrenergic, beta adrenergic, these are G protein stimulatory or G protein inhibitory or GQ, right? Where norepinephrine also, like alpha and beta, those are not intracellular. Cortisol, right? That is a correct answer. So cortisol is the correct answer. So that is a crosses the membrane, binds to the cytoplasmic receptors, produces the transcription and synthesize messenger RNA to produce various responses. Insulin, tyrosine kinase, right? So not intracellular. And diazepam is the ion channels. Diazepam is the ion channel. So the correct answer is cortisol intracellular receptor. The next one, a 71-year-old woman with the angina pectoris and sublingual nitroglycerin tablets become less effective. And over the past 18 hours, despite she is taking the same dose every 4 hours, and she denies the chest pain at rest, right? The physical exam is unremarkable. So which mechanism best explains the patient reduced response? We discussed about the receptor desensitization, right? So this is this phenomena called tachyphylaxis, right? So tachyphylaxis means rapid development of tolerance, okay, or desensitization, okay. So that is a tachyphylaxis. And upregulation, no, it is not upregulation of guanyl cyclase. Increased renal clearance, that is nothing to do with this. And competitive antagonism, there is a no antagonism. So the nitrate is an agonist activator. There is no antibodies against nitroglycerin. All right. So this is the tachyphylaxis. That means the continuous nitrate exposure. That is a mainly depletion of intracellular sulfhydryl groups that reduce the nitric oxide production. So that requires a nitrate-free interval. So that's what some time will give the nitrate-free interval. So there is some production, then it produces its response. That is the tachyphylaxis. All right, thank you. I hope you guys learned. So thank you, and please subscribe the Concise Medicine. See you in the next video.